Good afternoon, everyone. I'd like to welcome everybody to this discussion that we're going to have today. It's a new year, and this is the first event in a series of events really around recognizing the life and legacy of Dr. Martin Luther King Jr. I think that, the current times that we're in and the challenges we face as a country the events of the past week have really put a spotlight on the importance of these conversations specifically. As we were having conversations initially about what would the theme be for this week if we were going to host a week of events, if we were going to put on a series of opportunities for people to engage in these conversations and talk about the work that we face as educators and as professionals. One of the themes that rose to the top was the idea of promise and perhaps the American promise unfulfilled. Is one of the things I like about the Martin Luther King Jr. holiday and where it falls is that it's in January, it's at the start of the new year, and it calls for a time of reflection, but at the same time, it also calls for us to reflect on ourselves in the past year. And did we accomplish anything? Have we moved the needle? Have we made things better? And I think as we think of the promise unfulfilled and we think about the holiday, I think it also reminds us that we have a full year of work in front of us, that the promise remains unfulfilled for so many of our students, our colleagues, our friends and family, and that there's work to do. And so, as we move through this kickoff today, I'm really excited about this discussion and being able to engage in these conversations, but also I like to use this as a time to solidify a commitment to action and to a year of work in advancing progress on these issues. So I'd like to thank our panelists for making themselves available today. We've got an amazing group of educators and professionals to share their thoughts on these issues. And what we're hoping comes out of this conversation today is really to begin to look at the complexity of these issues. As you talk about issues of systemic racism, you talk about the issues that we see socially in our country that have been so glaring the past week. We really also start to see the intersection of what we do as a college, right? A college is an intersection of all different types of fields. And as we look at the current events in our country, we see the need for collaboration, that to really address these issues, we can't simply do it through one. We can't simply just cure the pandemic through better healthcare, right? There's so many other pieces to it. We can't address the issues raised by the Black Lives Matter movement simply by providing more education, right? It requires the connection of all these different facets of our society to really begin to hammer away at these very complicated, very complex, very systemic issues. So the hope is that this is the beginning of a conversation to help us begin to see how we can do that. And so we're going to kind of take the conversation in two ways. We're going to start kind of at the macro level. We're going to talk about the professions that these individuals, these educators represent, and how these issues are coming up in their work, how these are relevant in these fields of study. And then we'll bring it back down to talk about students, right? We're here to train emergent leaders. We are educating the next generation of professionals who will ultimately carry this work forward. And so having a chance to hear their perspectives on education and what we should be doing as educators. And then to close, I'd really like to solicit from the panel their thoughts on how to move forward. What are they worried about? Where should we be looking? What should we be doing? And how should we focus as a responsible organization to move forward? So with that, and just to kind of set the stage, I'd like to give each of our panelists a chance to introduce themselves. So I will kind of move around my Hollywood squares and give them each some time to talk about their field and their background and just to introduce themselves. So Dave, could we start with you, please?
Yeah, Dave Cece. I'm the Dean of Public Services and the Director of Law Enforcement Training at Oakland Community College. So we handle all the training for police, fire, and EMS personnel throughout the state and actually internationally and throughout the country. So, in my background, I was a police officer prior to this job. I was a police officer for a couple of different police agencies.
Okay, great, thank you. Anthony, could we have you go next, please?
Hey, I'm Anthony Thomas. I am a counselor for Oakland Community College. I work at the Orchard Ridge campus. As counselors, we do the full gamut of counseling services. So that's educational, personal, mental health. My background prior to joining OCC, I worked a little in private practice, did some marriage and family counseling, some substance abuse counseling. I also spent some years, about 10 years, as a firefighter in the city of Detroit. And so I worked closely with the police department in that regard.
Great, thank you. Mary, can we go to you next, please?
I'm Mary Miles. I am the Dean of Health Professions here at Oakland Community College. That includes nursing, surgical technology, radiology technology, medical assisting, dental hygiene, respiratory therapy. So lots of all of the health professions here at Oakland Community College. Prior, I have been a nurse for 36 years. The last 20 have been in education, but before I was in education, I was my field of practice for nursing was critical care nursing. And specifically, I'm an advanced practice nurse in critical care nursing.
Great, thank you so much. And Alfred, please.
My name is Alfred Dufrese. I've been teaching sociology at Auburn Hills and Orchard Ridge since 2015. Before that, I was an assistant professor of sociology at Roosevelt University in Chicago. I finished my doctoral training at the University of Michigan in 2011. I focused on race and cultural sociology. While in the program, I moved out to Detroit and ended up staying out here in large part because of a lot of youth advocacy groups in and around Detroit who are working on issues of social justice, race, LGBT issues. So from New York, happy to be in Michigan, happy to be on this panel with some very impressive folks that have done some pretty big things. So happy
Great.
to be here.
Thank you so much. And thank you to all of you. I really appreciate you making the time at a very busy time of year for us. So to kind of start our conversation, what I'd like to do is just invite each of you to share your observations about race and ethnicity and how that's shaping kind of the professional. So take your educator hat aside for a minute and really talk about your field, your discipline. What do you see? What are the salient issues and how are those being realized professionally in our country currently? And so, Dave, not to put you on the spot, but I think the events of last week really brought back that conversation as we saw the juxtaposition of what happened last Wednesday in the nation's capital with the Black Lives Matters protests that occurred over the summer. There was a lot of conversation in the national context about the disparity and inequity in response. And really just, there's so much has happened around law enforcement this year. I thought we could start with you.
So I think in the bigger picture, the industry is looking at multiple facets of what they're doing. It's not just, like you said, it's not just training. It's looking at hiring practices, trying to diversify the candidate pool. Right now, one of the issues we have is we need to get diverse student body in criminal justice in order to make people that can be hired out there to get these jobs. And when we're a little behind on that, we need to start working on recruitment practices. Also, the other thing that I think that we're missing out on, this may be, sound like I'm being a little harsh, but there needs to be some changes in how we handle officers on the job that have issues that are repeat offenders, so to speak, of problems. It makes there's a lot of difficulty in there to get rid of these bad apples, so to speak, that are in the profession. And that's a big factor, because that one representative that does that negative thing, that bad actor, they sway public opinion on law enforcement. And we're having a hard time, I think, figuring out how do we eliminate them from the job. So I think those are some aspects that are really being looked at right now. It's how do we hire? How do we have a police force that represents the community that we're working in? And also, how do we handle officers who are the problems? You know, we're also working on the training aspect. They're looking at that, and I know you said take the educator hat off, but that's just part of, you know, the job. There needs to be that training to open, you know, minds and eyes on both sides of it. The community needs, I think, to get to see some of what law enforcement does and some of their practices, and I think law enforcement needs to be open to learning about different communities and learning what their you know, jobs and how it reflects on the community, impacts the community. I think there needs to be that give and take, and I don't think we have that right now. I think that the law enforcement community is trying to find a way to start to be more open to change and to find out what they can do to make the change and a positive change. I think part of the issue is, though, both sides are very emotional, and sometimes when emotions are in there, the logic doesn't come into play, and we can't have those courageous conversations that we need to have. But I can tell you, the industry is looking at what we are doing wrong, what we're doing right, and how we can rectify that. Because it is a very impactful thing on society as a whole. That law and order that we need to help maintain a just society is important, but also it needs to be a fair and equitable administration of that justice. So I think we're on the right track to improving that. But there's still work to be done. I think it has a lot of listening needs to be done too, on both sides.
Yeah, no, I think that's great. You know, and you've raised a couple issues. You know, you talked about trust and faith in organizations and our systems and how that can be compromised. And maybe, Alfred, maybe you could speak a little bit to sociologically what we're seeing as it relates to trust and issues of race with our organizations, with our institutions.
Yeah, well, there's two ways I kind of want to approach it. So one, because sociology has not been innocent in terms of its dealing with race and ethnic issues over its own development. It reflected all of the early cultural racism that existed in the country as the discipline developed itself. So in a lot of ways, the discipline has kind of mirrored the problems in some of our law enforcement systems and notions of public safety and what those institutions should be, what their role should be in the first place. So we've had to make some strides just within the discipline to get that right. And that's included some steps such as David spoke to, right? Kind of diversifying the pool of people, right? Sociology as a discipline, it's faced some uphill battles at times. I was a recipient of a grant through National Institutes of Mental Health that has since ceased to exist, right? And that was about providing research opportunities and training for folks that had potential and, well, frankly, may have needed the cash, right? I wouldn't have come across that program if I were not able to be paid for the training that I was going to receive and also contribute to the organization, the school at the same time, right? So in part, it is about bringing in folks that have been underrepresented, right? Racial and ethnic minorities that have been underrepresented in the field of sociology itself. It's despite the discipline it's well equipped to deal with issues of race and to talk about race for what it really is. It doesn't mean that we have the numbers necessarily and even the diversity of viewpoints amongst racial and ethnic candidates that the field could have. As far as kind of understanding a lack of public trust, a lack of trust in institutions, I think David hit on a lot of that stuff as well. There's a lot of good ethnographic research that's been done in racial and ethnic minority communities that really tries to elevate the young Black and brown men in particular, but women as well, to elevate their cultural understandings of what goes on with police, right? It's almost trite that we have these ideas that Black and brown males, young ones in particular, are just built to hate and despise police officers. And it's a very easy narrative to get out there and run with. But when we talk about culture, there are things that become internalized, like David was saying, having this back and forth, this understanding. And it takes a lot to start to internalize fear of police officers and distrust and institutions. It doesn't happen like that, right? So to take quite seriously how it comes about and how that impacts people's day to day. And again, there's a lot of ways that happens, right? I was listening to a story of an officer in Flint who had some very negative experiences, but also saw the crime side of things, and that made him want to become a police officer. There are others. I had a number of negative experiences. I grew up in New York in the late 80s, early 90s, and there are a number of really terrible cases out there. And being that close, having had similar experiences myself, you know, it's not cultural in that you're born with it. It's cultural in that you experience a number of systems. And a lot of good sociological research has been done around elevating that, showing the complexity of it, so these things don't become reduced to some people just think poorly of cops. And on the other side, some cops are just racist. Like it never comes down to that. It's never that simple. And I think just the last point that Dave hit on really well is talking about consequences, right? Because that's in large part how cultures are created. The BLM movement is very much about what the consequences look like when there are bad actors, but also about kind of redefining what is public safety, what is law enforcement. I don't love the term law enforcement because it sounds like I need to know all the laws or they will be enforced upon me, as opposed to how do we rethink how we create safe communities. And that is something that will take back and forth in discussion, as David alluded to.
No, I think that's a great point. And I think that notion of community and safe communities really speaks to the complexity of these issues. Law enforcement is one piece of that, and that relationship to that institution in our country is one piece of it. But one point you said that kind of stuck with me is that you talked about training and having that opportunity. And one of the, I was in a conversation recently where we were talking about issues of race, and we were talking about education. And one of the comments that was made that was, education is the great equalizer for all of this. And so there was some pushback around that it's not so simple as simply becoming educated. And Anthony, I was wondering maybe if you could speak to it, because you see students as an educator, you are an educator yourself, but also you see kind of as a mental health professional, you see how some of these other institutions, some of this cultural anxiety and the issues that we're dealing with outside of school impact a person's ability to really engage in that educational process. And I was hoping maybe you could speak to that a little bit.
I think there are several layers. For instance, as Dave and Alfred were talking, so many things went through my mind. As a counselor, part of the issue is just access to mental health services for people. So in dealing with the police, I wasn't Psychology Today, or I read this last week that individuals with mental illness are 16 times more likely to die in a police-related incident, right? So when you take that stat, because our mental health services are woefully underfunded in our country, and then you think about the access that people of color have to mental health services, so it's exacerbated. So that's one of them. When Alfred just mentioned, oh my goodness, the acculturation, or in thinking about how our students, for instance, how we kind of look at race in this country. Like in our field, we want to have culturally competent counselors so that we can help individuals no matter their race, gender, ethnicity, whatever. However, I think how we look at race, and mostly prior to the last year, the last 8 months, how we saw race, I think most people would have seen race or racial injustice as something very overt. Someone being called a racial slur or something very overt. And now we've learned that, there are other forms of racism that are just as dangerous and damaging and nefarious. Microaggressions that occur, on a daily basis, and that's more so what we deal with in counseling students at OCC is the microaggressions. And I shouldn't assume that everyone knows the term, but a microaggression is what's the best way to explain it? It's kind of the everyday. It could be verbal or nonverbal slights or insults or that are communicated to typically a particular group of people. So in using examples that I've heard from students of color or even gender, that they're in a classroom and the instructor never calls on them ever, or they have maybe they're from they're an international student, and the instructor never gets their name right, even though they correct them every time. So those things build up, and those are forms of microaggressions and racial injustice. So anyway, I think there are many layers that have to be fixed before we can kind of make the progress that we need to make, at least in the counseling field. Again, one is the access to mental health services, and typically people of color don't have that same access to help. A lot of it, the trust within the police department, within the communities has to be built. I won't even say rebuilt, because I don't know if it was ever built in the first place. So those are kind of some issues that we're dealing with.
No, I think that's great. And I think this makes a nice transition to you, Mary, because, as Anthony talked about access to mental health and, sort of these passive things that occur that create these systems of inequity. The pandemic itself has really brought a laser focus to that, as we've seen just these gross disparities in mortality rates among people of color. And perhaps, this would be a great time to have you kind of jump in and give us the health perspective on all of this.
Yes, thank you. I don't know if it's an unusual time that we live in, that we have two really significant events or movements or awareness of both the COVID pandemic, and then the Black Lives Matter and those movements intersecting at the same time, because they certainly do, as to your point, certainly do highlight a number of issues that we have in healthcare. As you say, disparity among all people of color with respect to the outcomes. Certainly a very broad understanding for all healthcare workers of race and ethnicity and cultural issues is really integral to our practice. But I think I'm hopeful that when the pandemic is done, that we will really sit down and ask ourselves as a broad profession, why do these disparities occur? I don't think it's enough to simply put them down to what we would describe as the social determinants of health. So things like access to health care, the presence of chronic conditions, healthcare literacy, those kinds of things. To Anthony's point, I do think that there is a lot of microaggression in healthcare toward the patients that we serve. Even something as simple as not taking patients as seriously, or not giving credit to not listening to their complaints in the way that we really should be. I hope that one of the things that we will learn after the pandemic has passed is how can we serve people of color better within the healthcare system.
Great, thank you. I kind of want to marry what you said at the beginning of your comments about the intersection of these two kind of phenomena in our country right now, and circle back to you, Anthony. You made the comment about the relationship between mental health and interactions with the police and the connection there. And so I guess kind of the question I'd like to start with you, Anthony, but then open up to the group is, how do these disciplines work better together? How do we connect mental health to law enforcement? How do we connect our healthcare system better to our educational system and to our communities to begin to kind of, I think everyone acknowledges that there's a need for that synergy, but I'd be curious to hear your thoughts about how we start that process. Whoop, you're on mute there, Anthony. Whoop, you're still on mute. There we go.
Got it. Okay, sorry about that, guys.
Wouldn't be a Zoom call without it, at least fun, right?
I don't know. That's huge, but when I was a firefighter for the city of Detroit, whenever there was a call, one of the things that was written, whether it was a healthcare related call, say someone had fallen and was having a heart attack, and so EMS would go to a scene. Well, firefighters went with them. Whenever there was a police call, firefighters were also supposed to go, and so we worked in tandem. I think, and there's been a call for this. I don't know how you do it, but I believe that there should be mental health professionals within the police department who go out on the calls with the police for domestic disturbances. Or you have to have mental health professionals train officers to deal with people who, like, as I said before, are experiencing a mental health condition. Because if they're only trained one way, you're going to respond one way. If all you have is your equipment is your toolbox is a hammer, you're going to use that hammer for everything. So I think the training, there has to be a kind of a multi-discipline training, multifaceted training for people in our communities, that serve the communities, our social service workers, our police force. There was a second part to that question, wasn't there?
No, just your thoughts about how we begin to connect those organizations.
So yeah, in the other thing is that we learn from one another. So I think, again, we should have mental health professionals sit and train police officers, law enforcement, Alfred, on how to respond to people who are experiencing mental health episodes, or have some mental health professionals who are not. Some communities have done that where they have social workers on staff. Police forces have social workers on staff, but I think in 9 out of 10 cases, those social workers were dressed in police gear, and so they present to the community as police officers and not mental health professionals there to provide non-lethal assistance. Not that assistance is ever lethal, but officers have guns, and particularly within minority communities, there's not a lot of trust that they will respond in any way that's, in any non-traditional way, which is without the use of force or someone being arrested.
Sure, that's great. Thank you. Other thoughts about how we help to connect some of these organizations and these institutions in our country?
Right now we at Oakland Community College, the advanced police training and in the basic academy, we work with Oakland County Mental Health, and they offer what's called crisis intervention training. And it is essentially what you're talking about, Anthony, where mental health workers are training police officers on how to handle these type of situations. And it's a week-long class, and it's very intensive. I mean, they immerse them. There's classroom learning, but then they go out on the CREST site and they are faced with scenarios that are real life scenarios on how to handle people who are having a mental health crisis, and training like that. And it's really proliferating the profession where we recognize the importance of this and the need for it, which is why it was, when I got the job, that was really one of the important things to me, was to get a partnership with this group to offer this class here on a regular basis. And they, the cost is really minimal so that agencies can send people. And it really, it gets a very positive response from the officers, but also a lot of them told me how it's opened their eyes to a new way of looking at certain situations. And I just want to caution, I get a little defensive, but we don't teach all just use of force. I mean, there's a lot of aspects in the academy that, especially here, we have a large amount of de-escalation, mental health training, and interpersonal skills that we try to do, because I recognize what you're saying, that there is some of that where it's still that we go in, we use force, we end it, we arrest them, we're done. So I want to change a lot of that when we're working with the students. So we are working towards that. But I think, like you said, Anthony, a big part of it is marrying these two groups, where it's not just a police officer training other police officers, someone who's in the field of mental health, teaching these officers how to handle these situations. It's really important.
That's great. Thank you. Other thoughts, Mary, Alfred?
Yes. Let's see, a couple of things. So one, I think in part to what Dave just offered, and there's been pushes towards this, but because there's so many law enforcement agencies, right, and such different cultures within those agencies across the country, there are some successes where we see social science research, psychological research, the use of implicit attitude testing and unconscious bias training. That's been embraced in a lot of places, and it's had some success in places, right? But like any other set of steps, sometimes it's embraced, sometimes not so much, right? And then even within a given local unit, right, there'll be some who are with it and some who are less with it. And the only way, well, not the only way, but a couple of ways is, one, to have something that's more top down, right? And perhaps not just around funding mechanisms, because that tends to be the issue. If you do this, you get a little bit more funding. If you don't, you get a little bit less. Unfortunately, that doesn't speak enough to culture. And I think that's what something David spoke to early on. Within training, I would imagine there would have to be some kind of parity. Officers, potential officers, would really have to feel like the mental health person that's by my side and part of my training is key to this, right? It's not ancillary, it's not an extra, it's not to prevent certain things. This is every bit as important as all of the other training that is offered. And that's something that does have to be organizationally supported. Last point on that, well, I think the closest evidence I see of interdisciplinarity is when I get students who are on a CREST track, and we'll be working through something either in intro social or in the race class. And they're the ones that tell me, they end up educating me, and they'll say, well, this is what we learned about law and yada, 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 and procedure and yada, yada, yada. And I have to take the word for it. They're the experts on it. Like, I haven't done that. So, but they'll tell me, okay. And I see how this and what we're talking about is a little bit different, right? I'm sure there can be ways institutionally to kind of support that and make it more intentional. But it's hopeful. It gives me hope to know that students they kind of see, right? If they can identify how something is different, then that's a step towards integrating the best of both of those things. And yeah, sure, we could find ways to, sometimes it's just happenstance, it goes that way. But whether we kind of point out, this perspective and this discipline is one perspective, please connect it with something else. Do not pretend that this is the one and only way of seeing things. I do that because I went to school forever for this thing, but you all have an opportunity to not get caught up, right? And
Sure.
And I do. Again, it's kind of random as it happens, but I will get students who are doing both things, and they will share. I hadn't thought of it. I see how this is different. So there's something to build on.
Yeah. Absolutely. Thank you. We've used the word enormity, complexity, right? These are huge problems. And if Anthony had the answer alone, he'd probably be out consulting for municipalities right now in a different profession. A school, much like a hospital, is the intersection of a lot of those different things. And Mary, from a health perspective, I think you have a unique way to kind of talk about those partnerships and how they unfold, and maybe perhaps what they should be or need to be.
Yeah, I certainly think that from a discipline perspective, a broad understanding of all of these topics, and I think as has been mentioned before, mental health training, and really understanding that as a key component is very, very important to our discipline, and to intersect all of these different things.
Okay, great, thank you. We're kind of at the halfway point right now, and so I kind of want to shift gears a little bit. If any of the participants have questions, there will be a chance at the end, so you can start adding kind of your thoughts and your questions that have come up to the chat, and we'll have some time at the end to address those. But to kind of shift gears, I think we've done a great job of setting the stage. We're dealing with very big issues. We're dealing with institutions. We're dealing with hundreds of years of sort of cultural norms that are evolving and at times at odds with one another. As you think now as educators, and you look at your students, what do you want your students to know? What do they need to know? What are the skills that they have to go out into this environment and be successful and be agents of change for the better? And so, Mary, maybe we could kind of come back to you. As you send students out to that environment, what do you want them to know? What do they need to be able to do?
Well, when we educate healthcare professionals, we always start with a good understanding of race, culture, ethnicity in their basic training. And even when we try to teach them to be aware of their own biases, we try to teach them to have culturally competent care, to recognize the importance of culture as a component of care. And so we try to teach those things as very important. But I don't think that from a discipline perspective, we might teach them something while they're here at OCC or where they're in college, but it's definitely not enough. I think we are all in professions that require lifelong learning, and so it's not enough to say we're educating you about this now, but it's something that all healthcare professionals really need to be aware of, and to imbue to students the idea that you are lifelong learners, and that you need to learn about this or to be aware of it all the way along in your professional life. And so to that end, I'm very happy that as one of the executive orders that came out of COVID from our governor was that all healthcare professionals must have a CEU on implicit bias. And so on bias training, excuse me. And I think that's very, very important, because I think it is a significant part. I do think it is a factor in healthcare. And I think it's something that we always need to be aware of. So I don't think that, yes, we're training students here, but as professionals, it's something that we should continue to be educated on and to be aware of and to always be learning about.
No, absolutely. That's a great point. Thank you for sharing that. David, maybe we could cut over to you here, because perhaps law enforcement, more so than any other discipline, is under the microscope right now in terms of its standards and practices. And it'd be great to hear your ideas as somebody who's educating, in real time and graduating law enforcement professionals. What are you trying to get into them, and what do you want them to know and be able to do as part of this conversation?
Part of it, I know and this might sound a little trite, but empathy is one of those things that I really try to impart on the students, so they can, understand that while their role is like Alfred mentioned, that enforcement part of it. We need to have some of the softer skills too, to reach out to communities and to work with people. The other thing that I always, because I'm in the classroom with them a lot, I try to broaden their understanding, because what happens is, and it's just, I think it's a part of human condition, when there's so much negativity about the profession, and these individuals are going into the profession to make that difference, they have those good hearts where they want to go help people, and they get a little defensive and say, well, what the heck? I'm going into this and they're criticizing. I haven't even got on the road yet. I'm getting yelled at by people and told that I'm a dirt and a scumbag and all and it's happened to our students. I oftentimes will sit with them and talk and have the discussion and remind them, hey, look, you've got to look at the broader picture. You have to look at the historical perspective that we're coming from, the way law enforcement treated people. Granted, it's not your generation, it's not you specifically, but it's there. And we have to acknowledge that and look at that and recognize that influences people's feelings. And I think that's a big part of it is to bring that understanding to them, to say, hey, look, this is not necessarily an indictment on you specifically as a person, but you have to understand the context from where it's coming from. It is legitimate pain and hurt, and it's real, and it's justified. So I think that's one of the things I try to impart on them before they go out on the road, so they don't develop that bitterness, that coarseness, that they understand that, it's coming from a real place that we can fix, but we have to acknowledge that it was there. We can't just say, well, that's not a problem anymore. It has to be addressed, and we have to look at it and say, how can I make this difference, and not just take the defensive stance, if that makes sense.
Sure. Yeah, absolutely. Alfred, you perhaps more so than anyone are directly responsible for kind of helping our students build that understanding and this kind of skill set. What are you trying to accomplish through your work and through your instruction in relationship to what David just said?
I think David just put it in a nutshell. So I might have to have him come lead a couple of sections. Not that he's busy or anything, but I think that he really put it well. There's a tendency to individualize issues around race, right? And so to prepare his students as they go out to not have that individualized response, which is, I'm trying to do something, I'm coming from a good place. Why am I facing all this resistance? Why am I automatically distrusted? But I think he stated it exactly, right? And it's not that education is the great equalizer, but there's a history. There's a racial history in this country. The country's not that old, fortunately. And we're thanks to the historians out there, we're getting new stuff all the time. A lot of it often is just making clear what we know in the bigger picture, which is the anti-Black, anti-racial minority systems of oppression in place, and they were overt, they could be subtle, they're baked in, but I think he put it well, right? The more we understand that history and can kind of detach our sense of individual pride and purpose, right, from perhaps a myth of what the country is, then that bottom up and top down kind of building can start, right? David has to send folks out who are going to somehow be cool-headed and act in ways, or just be cognizant of what they might encounter. And that can start to change the trust, right? I think it's great when I have students who are in Crest, and then I have students who are not going to go in that direction, but they have to, for a moment, kind of sit with one another's different views on the role of things like law enforcement and gather the same background information on the history of the country and cut away the myths. And then that kind of gives a common ground that we have to build from. But I think that's it. We just, an appalling lack of real understanding of the racial history of the country that starts in kindergarten and works its way up to graduate school, right? With students. So I never knew that happened. So I think that's it. Like, he nailed it. It's a starting point. It is a cultural thing. He's talking about empathy. You don't feel like you can give people empathy, but you can certainly make a case for this is what you'll encounter. This is why. Can you understand it? It doesn't make you a bad person. It doesn't make them bad persons. But this is our social reality. So, like, let's
Sure.
just
Absolutely. Thank you. That one of the, well, I was kind of had one eye on the chat, and common ground is a phrase that's come through several times. And I think many times in the context of a complete lack of common ground, that we're so separated from one another right now that even something as simple as finding our shared, attributes, our likeness, which there's so much of, is a challenge. And it really speaks to the severity of the issue that we're having and how disconnected we feel. Anthony, you see our students as a counselor as they struggle with this, as they grapple with this issue. From a counseling perspective and advising students, what are you advising students? How do you help them deal with these issues, and how do you help them build those skills if they're struggling with them?
I think Mary mentioned it, and even Dave in a little bit, but Mary mentioned implicit bias. And so when helping students, I think we want them to develop self-awareness. And part of that is kind of acknowledging our implicit biases. And we all have them. Like, there's not one person who doesn't see race or color. There's not one person who's blind to race or color, and that includes myself. Trying to think, so one where I think we can kind of make progress, as Alfred said, is acknowledging the history of our country first. And that, most of our systems were built for the wealthy white landowners. And once we deal with the truth of that, I think part of it is educating our students at a young age to discuss race and culture and ethnicity, and then they won't be, for us. Okay, so when I'm asked to speak to groups about race and ethnicity and bias, so one of the things, a good question to start off with is asking the group, what's the hard part about talking about race or racism? And just rhetorical here, but then answers begin to roll in. And then you ask, what's the beneficial part about talking about race and racism? And what it does is it gets people to ease up and to kind of relax and realize that at least we're creating a safe space to explore these things and to learn about one another. If we teach those things to children at a young age, kindergarten, I think one of you mentioned going all the way back to kindergarten, then they grow up not feeling like it's a taboo issue or afraid. Part of us talking about it as adults, we have the issues because we don't want to say the wrong thing. We don't want to be offensive. And we also get easily offended because sometimes we see things from our own lens, like 90% of the time, and we don't have empathy for others. And I think Dave mentioned having empathy is a huge thing. So just circling back is helping students become self-aware. And mental health counseling is huge in that regard. Like I'll just use a quick example. This was back in 2008. I was driving, and I had my license, hadn't had a ticket in 12 since college. So I was in my mid 30s, and an officer pulled up behind me, and I got nervous. And because I was a counselor, thank God, I asked myself, why in the world did I just get nervous? And it took me some years to unravel it. But because I'm one of the fortunate who has access to healthcare, counselors always and therapists always say you should also go to therapy because it's a great thing. But in talking with a therapist, there was a memory that I had forgotten, something that happened as a child. It was my first encounter with police, and it didn't go very well. I didn't do anything wrong, but they were very aggressive, right? And so that's when my fear of policemen started, because I had a gun drawn on me as a teenager, and I was just not doing anything. Interestingly enough, I ran into one of my buddies. It was a group of us who was with me at the time. We were in high school, and I mentioned it. I told him, I ran into him 2 weeks after kind of unraveling this with my therapist, and I mentioned the incident to him. I hadn't seen him in 10 years, and he was an adult. This happened 25 years ago. He had completely forgotten about it, just like I did. It was so traumatic that we both put it out of our psyches. And so people of color kind of deal with this is these kind of racial stressors daily that, you know, we need to uncover. So anyway, that's just part of helping our students become self-aware. You know, why do you know why you're afraid of the police? Do you know why you get nervous here? Do you know why you feel maybe less than when you walk into a classroom, where you feel like you have to be combative? Why were you combative in this situation? The instructor, you know, so the instructor seemed to be respectful. Why did you take it this way? And so sometimes in going through this, and I'm sorry, guys, I have contractors here. Are you hearing that noise?
Just a little bit.
Okay.
Very good.
So we really want to help students become self-aware. But just a little nugget to Dave. Dave, one of the things I learned to do working with as a firefighter, working with police officers, is I saw how, like you said, as new trained, they get a lot. They get the brunt end of a lot of stuff that, you know, is not their fault, and it's a hard job. And so I taught my kids this: whenever you see an officer, smile and wave at him, because it might be the only smile he's going to get that week. So anyway, it's a tough job, but hopefully we could make some progress.
Well, you know, as we are having this conversation, I think we're not getting to the answer obviously today, but we're starting to hear, you know, a lot of the questions in the chat are about how can we help as educators, and I think we're starting to pull out some of the things that maybe we can do within our sphere of influence in terms of awareness, in terms of understanding bias, in terms of inaccurate history of the United States that we teach to our students, and hopefully this sparks some interest to continue those conversations and to continue to stimulate thinking about that. I think too often those things fade from front of mind and are only remembered when we engage in these conversations again. So hopefully some folks will leave today sort of diligent to continue that conversation about awareness and connection and common ground. So it's kind of to bring us to a close and give each of you a chance just to give some final thoughts. I wanted to turn an eye to the future, because there is one certainty, is that our country is only going to continue to become more diverse, and in substantial ways that are historically unprecedented. I wanted to read something from 2018. Kellogg Foundation did a business case for racial equity in Michigan. And one of the quotes from that really stuck with me, this is 3 years later, and I'm still talking about it, but by 2050, 40% of the workforce and consumers in Michigan will be people of color. It continues to say that by 2050, Michigan stands to realize a $92 billion gain in economic output by closing the racial equity gap. And so I want to kind of set the business aspect of that aside for a second, but it states in closing the gap means lessening and ultimately eliminating disparities and opportunity differentials that limit the human potential and economic contributions of people of color. And so, you know, it lays out a future for us where we are more diverse than ever before, but it also very succinctly defines a body of work in front of us. And so, you know, as we turn an eye to the future, we've talked to some extent about emerging leaders in our fields, but I'd just like to give everybody a few moments to talk about, as you look to the future, either personally or professionally, I don't care which, you know, what keeps you up at night, what causes you angst, and what leaves you with some hope. And Alfred, I'll give it to you and kind of reverse work my way through Hollywood Squares as we close. Oh, I think you're on mute there, Alfred.
My turn for that. Just to keep it brief, I think across disciplines, it's become more commonplace. Mary mentioned this kind of cultural competency. Tony mentioned what's going on with mental health and implicit bias training and law enforcement. As we move forward, these things are becoming more and more central and more normalized, right? Kind of taking seriously systemic racism. I remember being blown away when that became a phrase during Hillary Clinton's run. I was like, oh, we talk about that in school all the time. And now it's like common knowledge, right? So I am, despite what goes on, and there's always backlashes. That's the nature of American politics. But it is becoming more commonplace. So we have to just be careful about continuing to push that forward and not pretending that that is the entirety of the fix. But as the issues themselves become just built into how law enforcement is done and health is done and counseling is done, it's cheesy, but knowledge is power. It's hard to turn away from that realization, especially once it becomes the norm in the culture. So
I think that's so much of what we talked about, just knowledge and awareness and information, accurate, correct information to get to people. Anthony, how about you? What's keeping you up and what gives you hope?
What keeps me up is that I realize that it seems that our country is more divided now than it was a year ago. That's not true. It was just as divided, but now it's just a little known. On the flip side of things, there are people becoming more aware, and I think realizing that we can't succeed as a country if we remain this way. And there are people who are becoming agents of change. There's again, I always think it's difficult for adults when we've been set in our ways to change our viewpoints. And so two things when we talk about education, and no, it isn't the only aspect, but it I think is critical, is that when we think about what we're taught, we're not just taught things in school, we're taught a lot by media and the images that we see all the time. And there's a school in Ann Arbor where they changed their history books. And they changed their history books because in going through their curriculum, they realized that the first indoctrination that minority students had of their history was as slaves. And obviously white children, everyone, their first indoctrination of Blacks that you're taught in school from, 4th, 5th grade is that they're slaves. And so you internalize that. We internalize it, people of color, to mean that we're less than. And so will white kids. Oh, they're less than. And so they changed their curriculum, and their curriculum now, when their first indoctrination to people of color are as the kings and landowners in Africa. And so the first time they see they're seeing images of people of color, they're people of color who are esteemed. And so it's little things like that, which isn't so little, that they weren't forced to do this. So oftentimes we're forced to make changes, and they weren't forced to do this. So things like that give me hope.
Great. Dr. Dufrese, I know you have a hard stop. You have class to teach, so if you need to slide off, I want to thank you, and please feel free, but stay with us if you can. Mary, we'll go to you next, and then Dave, we'll finish where we started with you.
I think that the thing that both keeps me up at night and gives me hope for the future is the pandemic that we're facing. It's, the impact on the healthcare system, on healthcare workers. I very much worry about the impact that this is having on healthcare workers in particular, because I think that we're going to start to see a lot of post-traumatic stress among healthcare workers as this has continued to go on. So that really concerns me, both from recruiting students and retaining healthcare workers into the system. I think those two things are very, very important. I am hopeful, though, that when the pandemic resolves, that we can, again, as a profession, really look at how did this occur? How, when the next pandemic occurs, because there will be another pandemic somewhere, in the next 10 or 20 years, how can we do things differently the next time? And how can we re-examine the healthcare system? How so that we can improve it? We need better, as we've all kind of talked about, we need better public health infrastructure. We need to look at, again, why are there disparities in the outcomes among communities of color? Why is that happening? And so really looking at why those kinds of things have occurred.
Absolutely. Many times a tragedy affords us an opportunity to get much better.
Yes, I'm hopeful we can really do a deep analysis of why that has occurred.
Agreed. Thank you. Dave, we'll give you the last word.
So I guess it's a two-part thing, things that keep me up at night. One of the things, and it sounds, again, as hokey as it sounds, the safety of the students that we graduate. I always worry about them. It never leaves me. The other thing I lose sleep over is the defund the police movement. And I understand the tenets of it, so I don't want to minimize it or make it sound negative, but I also worry that when people hear that, it scares them and they think, do I want to go into that profession? They're going to take away all the money from it. Why would I want to do that? And I worry that it takes away our opportunities to get good people into those roles. Because we talked about that, about diversifying student population and diversifying the workforce. Well, if they're terrified to go into that profession because all they hear is negative, that's a bad thing. That worries me. That's the part that worries me. I lose a lot of sleep over that. I think about it all the time. On the flip side, the thing that I have hope for is that even though those things are out there, our numbers are the highest they've ever been for enrollment in all the academies, police, fire, and EMS. And the students that we're getting are the students that we want to make that change, those change agents. That's the part that gives me hope, that I see that they're still coming and lining up for the classes and they still want to do the job, and they're the right individuals. Their hearts are in the right place. It's what we're looking for. So that does give me hope.
Great, thank you. I think that's a good note to end on. As we look to the future, there are things we can see to be hopeful about, but also to reaffirm the commitment that there's so much work to be done still, whether it's in health and how we dissect the pandemic response and in what we see in there, or whether it's in continuing to understand the cultural dynamics around law enforcement. So we're at our time, and I want to thank all of you so much for the conversation. This is a start to conversations that I hope we continue to have at OCC, because I think they're essential to what we do, and I think they're essential to meeting our mission as a college. We unfortunately won't have time for questions, so what we'll do is I'll have Ken export the chat, and if there were questions asked, we'll send an email follow-up and get those to the right person so that we can do that. And then as you leave, I'd encourage everyone to, we're going to engage in a week of activities and conversations and discussions, but please be mindful that that doesn't end this Friday. It doesn't end on Monday. That these are critical to what we do, and we need to make with intention a commitment to keeping these conversations alive, and so that when we come back in a year and we meet each other again, that we can talk about our progress on some of these issues, as well as continuing to look for opportunities to improve. So thank you all so much. Have a great afternoon. Ken, did you want to do a quick plug for some of the other announcements? Dr. Dufrese had to depart, but he has a great professional development session later this week. And Ken, you want to say a little bit about the rest of the week?
Absolutely. I'm just going to share it on my screen as we speak here. These are the events we've got left for the rest of the week here. So please come on out. We've got the DIA is hosting an event tomorrow, and that's from 1:30 to 3:30. It's an amazing event where they go through artwork, and it really hopes to open up the ways that we all think and view things. And so it's really, we talked a lot about our own biases, and this type of workshop really helps to highlight our own biases and our own ways of viewing things, and opens up the idea of how others view things. And, for me, I've done this one twice now. It's an amazing event. We all met Dr. Dufrese today, and he's going to be hosting this event. That event is from 12 to 1. You can go to our Eventbrite for however you register for the event today. Go to that same location and you can register for the event as well. And I'll also send the link to everybody that registered. I'll send you the link to our Eventbrite page so you can go there and register for this event, these events. And then the Black Student Union is going to be hosting an event called the Dream Continues, where they're going to have 3 students talking about the Black student experience. And really looking forward to that event. I met with the leaders of that group on Monday, and they're really excited about hosting that event. And then we close this week out with the Martin Luther King Convocation with Dr. Fields is going to be our keynote speaker. We also have students who are going to be doing the reflections on MLK, and it's just always been a great event each year, and I'm really looking forward to that event on Friday. So I'll send that event. I'll send out the Eventbrite link to the group here through your registration. So you should be seeing that in the next 15, 20 minutes. So feel free to register for those events if you haven't.
Okay, great. So we'll close. Thank you so much for sharing your time, your expertise with us. It's, what I take hope in is that we have good professionals like you willing to lead these conversations and help shape the next generation. So thank you so much for what you do and for being here today.